South Carolina is one of the fastest growing Hispanic populations in the country.
In America, I think we tend to think everybody's going to speak English, and that's the only kind of patients that are going to come in.
I was brought in as a one-day event to work with them on putting them in the position of not being able to speak English, and so that they would understand what it's like as a patient to not be able to express themselves to a doctor or a nurse. We had 6 what we call scenarios in the lab where there's a mock hospital. In 2 of them, the person playing the nurse either spoke Spanish or Italian, and the nursing students playing the patient had to struggle to explain their symptoms to that healthcare practitioner. And so there was a real problem there because they really had to struggle.
It was very interesting to watch students go from station to station and see their reaction, and you could see them immediately relieved when they were at the station where there was a certified live interpreter. I was interviewing nurses and doctors about communicating with deaf patients, and they said that they had received little to no training in school about effectively communicating with culturally diverse patients. When we decided that we wanted to expand from deaf patient and nurse communication into Spanish speaking and nurse communication, we recognized immediately that we had that resource here on campus. We have the Spanish interpreting department. Dr. Baris and I talked about how can we apply this and use it at Upstate. You know, we have this excellent nursing program, and we really wanted to see some collaboration with the communications department.
Students were supposed to learn 2 things. One, what it's like not to be able to communicate in your own language with the doctor or nurse, and 2, which of the scenarios is the best, and by far you want to have that interpreter present.
If the patient doesn't understand what the doctor told them and how to take their medication properly, they're not going to get better, and they're going to keep coming back and back to the doctor and compounding their problem.
This class was primarily for nursing students, but in terms of working with people who are not speaking the same language as the dominant language of that institution, then doctors also often need training. And we saw that a lot when Tess and I were working with deaf patients, that there was a real gap of understanding.
It's required by law that you have to provide an interpreter. Some of the students weren't aware that that was necessary. There's a huge difference in being bilingual and in being trained to interpret in a medical setting.
The goal of this is to break down some of the barriers between patient and healthcare providers along linguistic and cultural lines. So we're trying to break those barriers down.
The component of empathy, I think that is what students, I hope the nursing students got out of this workshop, is that they can think back on the workshop and say, wow, I remember how frustrated I was, being the patient and trying to, explain to this nurse all of my symptoms, and they didn't get it. We didn't speak the same language.